Good morning. This is Nurse Eunice with Florida Train Academy. And in today's video, we're going to be covering how to care for a patient with preeclampsia. And so it is bright and early. It is 6:10 a.m. Eastern Time in the state of Florida. I'm going to give you all a few seconds to get your notifications and then to join our review this morning. Again, this is Nurse Eunice with Florida Train Academy, and we'll get started shortly. Good morning, everybody. All right, so let's talk about Angela Williams. Angela Williams is a 28-year-old female. She is African American, and this is her first pregnancy. So G1P0 means gravida 1, which means that this is her first pregnancy, and para 0 means that she hasn't delivered any kids before. So first pregnancy, no live births. She has no chronic conditions, and her current medication is a prenatal vitamin. Angela's chief complaint is that she comes to the prenatal clinic at 34 weeks of gestation with complaints of severe headaches, visual disturbances, she's seeing spots, and she has swelling in her hands and feet that have been present for over a week. You're the CNA, you take the vital signs. The initial vital signs, the blood pressure is 160 over 100, the heart rate is 90, her respiratory rate is 18, her temperature is 98.6. You collect urine and you find that she has +3 protein in the urine specimen. The nurse checks her reflexes and she has hyperreflexia, which means that her feet, instead of them being stable, whenever the nurse presses on them and releases, they oscillate. That is a sign of severe preeclampsia. She also has +3 pitting edema in the lower extremities, and you put on the device to monitor the fetal heart rate, and the fetal heart rate is 140. So, in the chats, which of those are you concerned about? Which of those assessment findings? If the nurse wasn't in the room when you were doing this assessment, what would you call her in the room about immediately? All right, giving you time to put your answers in the chat. And if you said the blood pressure of 160 over 100, the pitting edema, the fetal heart rate of 140 is marginal, and the fact that there was protein in her urine, yes, you are correct. The blood pressure, yes. You definitely want to let the nurse know about those. So you've notified the nurse who since notified the doctor. And now we have an order. Remember, she's at the clinic. So now we have an order to admit her to the labor and delivery unit for observation. So she has to go to the hospital. She needs continuous fetal monitoring. There's an order for magnesium sulfate because of the preeclampsia. She's at risk of seizures. Antihypertensive medication will be labetalol, and she needs blood work. She's a CBC, liver function test, renal test, and 24-hour urine collection. So, as the CNA, you have to be looking at these orders and thinking about what your role is. And the next question is going to help you. So, let's go. Question number 1. What is the priority action a nursing assistant should take when Angela Williams arrives on the unit? A, measure her blood glucose level. B, prepare a bed and ensure it has clean linens. C, connect the patient to continuous fetal monitoring. D, assist the patient to change into a hospital gown. What is the priority considering the fact that she and her baby are at risk right now? And I'm seeing answers, but I'm not seeing one that prioritizes her health. So the gown and the bed are not the priority. The one that prioritizes the health and the safety of her and her baby is for you to connect the patient to the continuous fetal monitoring. And it's a really easy device. It literally has a strap. You put the device against the stomach, and it's going to monitor the baby. How viable is this baby, considering this mom is being rushed to the hospital to be monitored for hypertension, possibility of having seizures. So to connect the patient to the continuous fetal monitoring is the priority. The other stuff, the bed should have been cleaned before she was ever admitted, and the hospital gown, we can get to it when we get to it. Continuous fetal monitoring is essential to assess the well-being of the fetus in a patient with preeclampsia, ensuring timely intervention if distress is noted. So let's talk about this, because some of you all will be working on the labor and delivery units, especially if you're going to be a float tech where you get to float to various departments. And so some of the concerns that the reason why we take high blood pressure in pregnancy or preeclampsia so seriously is because the heart is being impacted. The heart is being remodeled, as we call it. The urine has protein in it, so we have some kidney damage. They can also have severe pain, and we like to refer to this as HELP, and it's HELLP. And HELP stands for hemolysis, which means that the blood cells are breaking down. They can have elevated liver enzymes, so there's liver damage also, and low platelet count. So if the platelets are low, they're at risk of bleeding. Not to forget the CNS, the central nervous system concerns, the severe headache, visual disturbances, the hyperreflexia or the clonus I was telling you about. This person can go into seizures. So your priority as the CNA when you have a hospitalized patient is the gown is nice. I need you to get those monitors on them as soon as possible. All right, so part 2, monitoring and ongoing care. After 6 hours on the unit, Angela Williams' condition is reassessed. The blood pressure is 155 over 95. The heart rate is 88. The respiratory rate is 18. And the temperature is 98.4. She still complains of persistent headache, but she has no visual disturbances. She still has a hyperreflexic response. And now the fetal heart rate is 145 beats per minute, 145 beats per minute with moderate variability, which means that the baby's in distress. Here's your next set of questions. Question 2. What is the most important observation the nursing assistant should report to the nurse during this reassessment? A, the patient's blood pressure remains elevated. B, the patient's headache persists. C, the patient's reflexes are still hyperreflexic. Or D, the fetal heart rate shows moderate variability. Yes, Fatima. Yes, great job. We need to report that mom's blood pressure is still elevated. So the patient's blood pressure remains elevated. That's what you're going to report to the nurse. Persistent hypertension and preeclampsia can lead to severe complications for both the mother and the fetus, necessitating continuous monitoring and possible adjustments in treatment. Great job, CNAs. Phase 3. So, what I am doing is I am preparing you for nursing school by way of CNA test. I know I trick you uh, because when you take your nursing exam, these are the type of scenario based questions that you will encounter. This is what you're going to be encountering also in nursing school. So instead of me just asking you 20 questions, I need you to think this through. And this is what this whole week is going to be about. We're going to be doing case studies to helping you care for a patient who just doesn't have one single condition. This is a human. Yeah, I want you to provide holistic care, including their psychosocial and their emotional well-being. So let us continue with this, but that is the reason why I'm changing the format this week. We're not just giving you standstill questions. It's going to be things designed to make you think. So now time has elapsed. Later that evening, a new CNA comes in and the updated assessment. The blood pressure is now 170 over 105. The heart rate is 92. Respiratory rate is 20. Temperature is 98.6. The patient reports a worsening headache and epigastric pain. She has increasing hyperreflexia with clonus, and the baby's heart rate is decreasing. It is 135. I keep saying 135. It's 135 beats per minute with late decelerations. The baby's heart rate is dropping. What do you want to notify the nurse about? What is concerning you about mom and what's concerning you about baby? Please put it in the chat. And let's see what answers we have. So if you said the blood pressure of 170 over 105, the worsening headache, the increasing hyperreflexia, and the heart rate of 135 for the infant, excuse me, for the baby, you're absolutely correct. So your question number 3, what should the nursing assistant do first in response to the patient's condition? Is it A, increase the magnesium sulfate infusion rate? B, reassess the patient's blood pressure in 30 minutes? C, notify the nurse immediately? Or D, provide the patient with ice packs for her headache? Yes, all of you all have the correct answer. Yes. I need for you to go get that nurse, and don't assume that your nurses are always going to be attentive. As a senior CNA, when you have a new nurse, no offense, sometimes you are more in tune with the patients than the nurses are. The same thing for new doctors. The doctors will come to the nurses and say, hey, what should I order? So we have to work together to help take care of a patient. Plus, if you're on a labor and delivery unit, what if your nurse is with another laboring patient? So don't assume that she is aware. Get up and go tell her what is happening. Notify the nurse immediately. The patient's worsening symptoms and fetal distress indicate severe preeclampsia requiring urgent medical intervention. And that medical intervention could be an emergent delivery via cesarean delivery. So she may have to go into the operating room and have a C-section. And because you all did such a great job notifying the nurse, I didn't have preeclampsia, but my son's umbilical cord was wrapped around his neck. And I don't let anyone know that I'm a nurse. So when I go to the doctors, the hospitals, I just want the treatment you're going to give everybody else, no special treatment. And so they rupture the membranes because I think I was already like 41 weeks pregnant, and he just wasn't coming out. But I wasn't feeling him move as often in my belly. He wasn't moving anymore. And so they take me in. I'm in a delivery suite. I'm going to try to have a baby via vaginal delivery. However, as soon as they ruptured the membrane, I heard the heart monitor going from really fast to starting to go really slow. And I knew that meant that either me or my son were in trouble. One of us wasn't doing too well. And that nursing team, including the CNA, they were so calm. All I heard them say was, "Can we get help in room number blah, blah, blah?" 6 people came to the bedside, brakes unlocked. They whisked me right into the surgical center. I delivered the baby via cesarean delivery, and we both were fine because of the nursing team. So, if you are thinking about working in a labor and delivery unit, you can help not only save the life of the baby, but the life of the mom too. So, here we go. You did a great job taking care of Miss Angela. The recovery and discharge planning with healthcare disparities. So, after an emergency cesarean delivery, Angela Williams and her baby are stable. The healthcare team discussed discharge planning and addressed disparities in healthcare. So, disparities in healthcare could be the differences in the type of care a person receives based on their social or economic disadvantages. And so, as a healthcare provider, you are not to discriminate based off of race, sex, abilities. And unfortunately, some of these healthcare disparities can last for generations. And so, now in Angela's case, not only is she an African American woman, but in her community, African Americans, even though they only make up 13% of the US population, they represent almost half of all new HIV cases. And for the cases of those who die during birth, they make up the majority of those who die. So you are doing a great job by taking care of Angela. And after you did everything you were supposed to do, her vital signs are now blood pressure is 140 over 85. Heart rate is 80, respiratory rate is 18, and temperature is 98.6. I am so proud of you. She reports feeling better, and when you walk into the room, she's now breastfeeding her baby, and the baby's vital signs are stable. Here's your next question. Question number 4. Which instruction is most important for the nursing assistant to enforce discharge teaching for Angela? So your nurse usually performs the first teaching, but you reinforce whatever was taught. It's always a constant reminder. Considering potential healthcare disparities such as Angela's inability to afford infant formula or child care. So you have made this bond with Angela. She's expressing her concerns. What should your response be? A, take your prescribed medications exactly as ordered. C, schedule a follow-up appointment with your obstetrician. C, monitor your blood pressure at home and report any high readings. D, reach out to support groups or community resources if you need help. And that passage did not talk about her blood pressure. This is her worrying about how she is going to feed and care for her baby. What should be your best response? Revealing the answer in 3, 2, and I need you to address the question or the concern that she had at that moment. So, reaching out to support groups or community resources if you need help. A community resource could be WIC. WIC provides vouchers so that she can get formula for her baby. And this is so important, especially during this time. I don't know if you're aware, but the students at Harvard actually get food stamps. It is hard out here for a lot of people. So when the patients are in your presence, you shouldn't try to make them feel lesser than, because you're in a better situation than they are in, because tables can turn quickly. So if you have information about any resources, you want to provide that to her. And these are some different social determinants of health. Someone could be impacted due to their economic status, the neighborhood they live in. Think about those communities that don't have access to fresh food. They have liquor stores and I don't want to call them poker bars, they're little games, the game stops in different areas. but they don't have the resources that you'd find in more moderate income areas. Sometimes they have lesser educational opportunities. They have less quality food, which I already mentioned. And then the community and social context. Maybe there's not a lot of support systems in that community, but she can always reach out and reach online too. So, this is a different way of doing our practice questions, but for preeclampsia, I hope that you learned that the blood pressure is high in someone who is pregnant. It mostly affects African American women. If you, as the CNA, don't monitor the mom and the baby, both of them could die. Unfortunately, the mom could have a seizure. So, by you being an awesome CNA, documenting and reporting to the nurse, you're going to help save the life of a mom and a baby. And so, great job taking care of your patient with preeclampsia. Later today, we'll take care of a patient who is suspected of having a drug overdose, who is fighting you while you're working in the ER. So let's do some more scenario-based care so that we can get you out of the mindset of just answering questions and know that there is actually a real patient in the future that you're going to be working with who has specialized needs. So everybody, this is Nurse Eunice with Florida Training Academy, and I'll see you in the next video. Bye.